Okay, so good afternoon, everyone, and welcome to Midshore Behavioral Health pre-bid conference for our open request for proposals for our Midshore Community Needs Assessment. The needs assessment RFP was issued on December 11th, and it will be closing on January 10th. And part of our process, anytime we have an open procurement, is to host this space really for any intended or interested party to have the opportunity to meet with Midshore Behavioral Health team members, really as a Q&A session more than anything for you all. So the hope is that you've come to this space this afternoon with any questions about the RFP document or the process or what to expect, or really the vision for where we hope to go with this final product once it's completed. So we really just encourage engagement, and don't, any question you have is not a bad question. I will share, though, that outside of this space that we're holding here this afternoon, we are not able to have any formal correspondence during the open RFP period outside of this time. So this is really your opportunity if you have questions. If you're going to email something, you're emailing something to the team or have another question after today, unfortunately, we don't normally entertain those questions, just to be fair to the other potential vendors that might be responding to the RFP. Today's Q&A session and conference will be posted on our website. So for those individuals in the community that may not have had the opportunity to make this time, we do have it available on our website. And that's just a standard practice that we kind of support anytime we have an open procurement. So we will, with the guests that we have here this afternoon, we're going to go around and just do a round of introductions. And then I'm going to hand it over to Taylor Garrett, our hub manager, to give just kind of a brief overview of the vision of the needs assessment and what we hope to intend to use with the product, the outcome of the work. And then we'll open it up for questions. So I'm happy to start. My name is Katie Dilley. I'm the Chief Executive Officer here at Midshore Behavioral Health. And to my right, I see Bridget Keeley.
Hi, good afternoon. I'm Bridget Keeley. I'm a Programs Director here at Midshore. Nice to see you all.
Thank you, Bridget. Taylor Garrett.
Hey everyone, I'm Taylor Garrett. As mentioned, I'm the hub manager here at Midshore Behavioral Health.
Taylor. John Hickman.
Yes, I'm John Hickman with Beacon at Salisbury University.
Great. Thank you, John. Trish Todd.
Hi, everybody. I'm Trish Todd. I'm the Data and Quality Manager at Midshore Behavioral Health. It's good to see everyone.
Thank you, Trish. Stacy.
Let me find my mic. Good afternoon. My name is Stacy Gardner, and I am wearing two hats today. I am with Caroline Better Together Collective Impact Group and DC Center Coordinator for Programs.
Thank you, Stacy. Tessa Alexander.
Hi, I'm Tessa Alexander. I'm with Co-Sparrow Consulting. We're a social impact firm based out of Dallas that works with national clients.
Thank you. Jessica, I don't.
Iacona, it's okay.
Okay. Iacona.
Yes.
Okay, great. Very
I'll,
nice to have
I'll
you.
add another step in there. It's Jessica Iacona Yankee. I'm the Associate Director also with Beacon at Salisbury University.
Great. Thanks for being here. Teresa Crow.
Hi, I'm Teresa Crow. I'm with Arundel Lodge, and we provide telemental health services on the shore for your deaf and hard of hearing clients.
Thank you for being here, Teresa. And we have an individual joining us this afternoon by phone with a 301 area code.
Hi, this is Beth Langbine and Laura Maddox from Dewey's Partners.
Wonderful. Thank you for being here. Okay, so I'm gonna hand it over to Taylor to just do kind of a general overview of what we hope and to yield from this RFP and the vision, and then we'll turn it over to you all for some Q&A.
Thank you. So originally the idea for this needs assessment came about through the consortium grant that's being held through the state of Maryland. We are doing a needs assessment for students in our 5 counties to determine what their needs are, what gaps are not being served currently in their areas, if there's anything that sticks out to mental and behavioral health needs that we can help find support for through this grant. Also with the other initiatives that are going on in the state, the Enough initiative and Blueprint, there are other needs that different organizations that we partner with that are also looking for information on the communities and the students in those communities. So our hope is to be able to find those gaps, to be able to better help the students in our 5 county area. And then also, since we're doing across the lifespan, it can be utilized through other programs here at Midshore. I think we'd share it with our, local management boards and such for them. I'm not sure if there's other specific programs here that we would use it for, but yeah.
Yeah, so the last time we did a full needs assessment of this scale was in, I believe, 2015, 2014, 2015.
I thought that's what it was, but I think I saw something from 18. I'm not sure. That didn't sound right to me either, but
Yeah.
14 definitely.
Yeah, so 14 was really our last full scope needs assessment. So we're well overdue, and things have changed dramatically since then. So we're really eager to see where we stand. And to Taylor's point, there's a lot of sort of parallel initiatives happening in the state of Maryland right now, where this process will be very, I think, extremely valuable to have, and really looking to kind of tap into the opportunity to touch on several different data points in the community in the process. So it's exciting, and we're just happy that we have the available resource right now to support something like this.
Right, because I think, Katie, we might also want to mention that this needs assessment will inform our community behavioral health plan as well as any activities we have on the hub.
Absolutely. So we do, what Trisha's mentioning is we have an annual process where it's essentially a type of needs assessment that Midshore Behavioral Health does, where we evaluate our behavioral health services here in the 5 county region. And we, serve also in some aspects of the work we do, we serve the whole shore. So we really do pull in a lot of information to that. But this is unique because it's much broader. And the fact that we've opened it up for the lifespan, I think, is really exciting and unique. So now we're going to ask you all if you have any questions or process or anything. If we can't answer, we'll do our best to try to follow up in a formal email. We'll collect the question and post it.
Hi,
Okay.
Katie, this is Lauren. Can I ask a question?
Sure. I'm gonna have you go first, and then I think Stacy was trying to talk at the same time. So we'll take your question, then we're gonna go to Stacy.
Oh, sorry, Stacy. We're on phone, so we can't see people online. But just a quick question. Hopefully, this may relate to other questions folks have. Is have you guys crosswalked the requirements of the different initiatives already in terms of the way you framed up the scope, or is that something you're looking for the firm you hire to do? So, in other words, enough has its own set of requirements. Blueprint has its, consortium has theirs with Hub and Spoke. So has Midshore done that crosswalking already, or is that something your expectation is for the firm to do that to make sure that it hits all of those needs?
I think that's a great question. So that the quick answer is no, we have not done that formally, but we've begun the process of engaging the stakeholders who need to be a part of that process. So just last Thursday, we hosted the first of, I'm assuming, several meetings that we'll have over the next few months, and maybe even well beyond that, with the leadership groups of all three big initiatives. So we've just started the conversation with those stakeholders in our 5-county community that are responsible for executing each of these important elements. We've got the blueprint, the Enough Act, and the consortium work. So I would imagine that the vendor that's selected would really come in and help guide and identify, all the different priorities to make sure that this needs assessment does satisfy most of the components of that work. So not sure if that answered the question, but Taylor, I see you come off mute.
Yeah, I wanted to add, we added in the main focus areas that we were thinking about, and those kind of offer a broad suggestion of all of them. Economic stability, which is going to be more of an enough focus, the behavioral health, which is more of a hub focus, and then the cradle to career, which is blueprint focus. So we kind of have the idea of the key areas that need to be assessed. It's just fine tuning them and how to drill down into them, I think, is what we still need.
Thank you both. That's really helpful. Just looking at the latest RFA that came out of the consortium and some of the criteria they're using, we just weren't sure how granular you had gotten with that. So that's helpful to know that's part of the thinking, and that you have a group convened to make sure that it's, that it serves the multiple needs. That's great. Thank you.
Stacy, did you want to go next?
Thank you. I was just thinking of how I wanted to form a question. So how can the community, I guess, assist you with this? I'm located in Caroline County, and Caroline County has a collective impact group that's called Caroline Better Together. And we have done some of the assessments, and I think we are part of the Enough initiative as well, with Federalsburg on the Eastern Shore. So I guess my question is, I asked it already, how can the community, or how can we partner, I guess, to get the assessments that you need to have done?
Well, I'm just thinking, and please, anyone else on our team chime in. So I would imagine groups like yours would be a critical stakeholder in this process to inform the needs assessment. So we're going to be seeking out working with, I would hope the vendor that's selected would be meeting with groups that have already been very involved as sort of like a foundational partner of how we've already been doing this in kind of pockets and parts of the region. So you're going to be a critical resource in my mind, to inform the work. And I don't know if anyone else has thoughts on that, but
I was thinking the exact same thing, Katie, that whoever we choose, hopefully we'll be reaching out to them, to the community supports to help with developing the assessment.
and informing the work, informing the assessment.
Right.
So we're going to be, I know we've already gathered a lot of information of the work that's been done, like historically, and this work that's already being done, it's actively happening. So our leadership from our local management boards and our school systems, we've been doing a lot of data sharing already as to what do we all have. Like Trish mentioned, we have our community behavioral health plan. So we've got these very rich, data rich pockets of information. I'm thinking our Shore Regional Health System does their own process that we pull from. And this is really a platform we're hoping to bring all of that information together and build on it. So I'm not sure if that helps answer your question, Stacy, but that's sort of my vision on where you may be a piece of that process. And Tessa has her hand up, and then Teresa after Tessa.
Thank you. This kind of follows up her question. Do you guys, when you have this behavioral health plan that's already established, what was the data that you said there's lots of data already? Is all of that qualitative, or were there quantitative, has there already been stakeholder engagement in terms of focus groups or expert interviews where there's actually been a lot of conversation, or is most of it demographic data and survey data that you guys have from the past that we would be able to, or that the vendor would be able to, review in advance? I guess my question is, what has been your stakeholder engagement process to get to that behavioral health plan?
Trish, do you want to take that one?
Sorry, I got a little sidetracked, so hopefully I'll answer your question here. If I don't, or get a little,
I'll
just
chime
let
in
me
too.
know. But I think, what we have, what we call a mature planning collaborative, and that group it consists of us, as well as mature behavioral health, as well as the 5 county health departments. And so what we're using is just a lot of state access data and stuff like that, dashboards and things like that. And we just sort of, that's kind of my primary responsibility in the plan, is to, to pull a lot of that data and look at it, year to year, and as a team, we analyze that data. So, we're pulling CRISP, we're pulling school data, we're pulling utilization and penetration rates from Medicaid claims data. We're reporting our, anything that we have contracts for, like our crisis information. We're pulling, we have contracts for crisis services, and so we're pulling our own report data, and that's what we use to compile that.
Gotcha. Thank you.
Yeah,
Kathy,
for that.
did you have
And thank you, Trish. And for the community behavioral health plan, we have, it's interesting. So that process is informed as well by engaging our regional advising councils. So they're not necessarily stakeholder focus or focus groups or interviews, but we rely on our regional behavioral health advisory council, as well as each county has a local drug and alcohol abuse council. Their voices are we lean into them to inform the work. But actually going out and doing like consumer or community interviews has not been a part of that process. It has been talked about, like, we really should have an element of this where we're going out and convening individuals, especially that are recipients of public behavioral health services. So that's our primary responsibility in our local behavioral health authority role, is to be touching on what the needs are primarily in that population and what we're not, and what services we don't have, right? So help, that really informs, like, okay, well, talking about like the crisis system, that annual process really does help us understand is what's working well and where we still need to advocate for more resources.
Mhm.
But to branch out into the community for those interviews, that's not something we've done historically, but I think there'd be great value in seeking that voice out in this process. And it's a large scope of information to touch on, but you can certainly be pulling from what the story is out of our data. That's that
Mhm.
qualitative, or quantitative, excuse me, information to really have that platform to know where to start, I would hope.
Okay, great. Thank you.
Sure.
And then I have one more, but I can wait until after.
Okay, we'll let Teresa go and then we'll come back to you.
Great.
Teresa.
Hi, yeah, my expertise and my focus is on the deaf and hard of hearing community. So I thought I understood, and then I was like, no, I don't understand. And now I think I might understand. So let me tell you what my thoughts are, and then you tell me whether they kind of align with your goals, or if there is a different way that we can partner with you. When I originally read the RFP, I was like, great, let's collect some data on the deaf and hard of hearing community. And unlike Stacy in Caroline County, the deaf community on the Eastern Shore are basically individuals kind of spread out over the entire landscape. So it's a different type of community on the entirety of the Eastern Shore. So when I started to kind of draft a proposal for you, I started with actually designing a data collection methodology that would work for the deaf and hard of hearing community, that was comprised of focus groups and in-depth interviews with community members, because the deaf people on the shore are hard to find. I mean, we have certain agencies, but by far most of the deaf people are pretty isolated. So I'm kind of thinking that I know some key people in the community who can help draw. So when I was originally thinking about that, that's what I was thinking of, was that that I could contribute, or Rundle Lodge could contribute with the deaf therapist and I working as a team to go collect information about as many deaf people as we can find, and asking those specific target areas that you have in the RFP. So my question is, am I anywhere in the ballpark with that idea? And the second question is, if not, how best can I help you add in information about the deaf and hard of hearing community?
Well, and again, anyone else on the team, please feel free to chime in. But I think I look at you, Teresa, and your vision, and your enthusiasm around wanting to raise that data up and try to seek out those individuals is really exciting. I mean, that's an area that we admittedly don't do well. So when, just full disclosure, Teresa had sent an email ahead of time just expressing interest around and raising up the deaf population as a priority group. I think you would be a valuable partner to help inform the work, because you have that connection and awareness a lot more than necessarily, a larger group that's taking on maybe the full scope of the project. But I see you as someone that we really need to make sure is at the table to help support the process. But, I don't know if that really answers your question, but I just am very grateful that you have have continued to advocate and bring that the population, the deaf population to the table, because we don't do that well, admittedly. Even in our community behavioral health plan, we do have a whole element of that that's a strategic plan on how we support cultural and linguistic services, which we really aren't informing that from the voice of the community member or the recipient of services. So this is, I think, very grounding just to keep the deaf population and several other, I mean, that our blind spots of what we're not thinking about when we really kick off this work. We need that support. So I just want to thank you for that. So I see you as a critical partner in informing the work.
Thank you. What would it, and I'm aware that the deaf community, in terms of its position in the overall large community of county by counties, is very, very small. So is it better for me to not submit a proposal for the RFP, but instead kind of wait to be invited by particular groups to participate in however that would help? Would that be more helpful?
Well, I'm not in a position where I can tell you what to do necessarily, but I think we really need you to help inform the process. I mean, if you have the motivation to attempt to take on the RFP, that's really something that only you can determine. But if you choose not to respond to this formally, I would hope that you'd be open to being at the table as a really key partner.
Oh, I will always be at the table with you whenever you need, so.
Oh, well, we appreciate that so much.
Yeah, that I just didn't want to, like, is this the 75,000, is this a 75,000 for all the counties? Or do you have 20 75,000s to give to different groups?
We just have, right now, we've just got the one for the 5 counties.
Okay, all right.
And that's why we also are very tuned into the budget climate in the state right now. So this opportunity, I'm just like thinking back to putting in that application and including this funding to support this. And I'm just glad we did, because I don't know if we would be in a position to do that in the next few years, sadly. So we're really going to have to be nimble and just very grateful for this opportunity to do this with the money that we do have available.
Okay.
So
I was just
sorry.
gonna say, and I don't think Arundel Lodge will put in for the RFP in its entirety, because of, you have one RFP for the entire shore.
No, it's five counties, not the whole shore, just the 5
Okay, the
mid-shore
5
counties.
counties.
Yeah.
Okay. So the 5 counties, but if there's a way that you could communicate to the 5 counties that, or whoever wins the RFP, that if they would like to include the deaf community in their areas, just hit me up and I'd be happy to get involved and help.
Thank you, Teresa. Okay, Jessica, and then Due East. And you're muted, Jessica. It's okay.
Teams gets me every time. So more or less looking at the cradle to career aspect of the RFP, are you looking to get in touch with the protected population? So like under 18, more or less just questioning for IRB, because a lot of the time when working with youth, young adults, it's a little bit longer of a process. So just curious as to that aspect.
I do think we would be interested to hear from 18 and under. So yes.
Thank you.
Good question. And Due East.
Thank you. We have a couple of questions. First question is wanting to just get a better sense from you all of what the final deliverable looks like. So you have full assessment will be completed by June 30. And then under the description of the process, it says contributions to the written report of findings. So we know there's a written needs assessment here, but wondering if you all can paint a picture of what you're really hoping that final deliverable will look like.
Anyone else want to take this one? I'm happy to, but I've been doing a lot of talking. Well, I think it's going to be a very robust report. I would hope there would be a lot of like interactive data that we can, be pulling out and applying. And I don't know, I'm going to look to Trish for probably the semantics of what that would look like. So I would envision, yes, like a written report of reference, but we may be working with the vendor to identify how we want that information presented in other platforms to be a resource to the community, whether that we work with you to add a component to our website potentially, or be supporting some formal presentations of the data to some of our key stakeholders. So some of that product definition, I think we'll have to really sit down and define what makes the most sense after we've selected our vendor. So whatever your vision is of how that needs assessment could be presented would be really nice to include in the application, because it's not like a one size fits all. Like, we're really open to hearing from you all. You're the experts. This is not our expert area, but we're open to receiving, I think, any presentation of how it is. But there will be some narrative reporting, I would think, that would summarize. I do know one of the priority things that we've heard and tried to translate into the RFP is the expectation that there will be regional presentation of information, as well as county specific. So however you see the best way to present that is something that we're really trying to pull in as an expectation. So it is easy for our, let's say, Caroline County as an example, to say, oh, look, we have this regional assessment, but let's pull this, extract that Caroline County specific information. That's going to be really important to be able to do. And I don't know, Trish, I'm looking at you because she's just visionary when it comes to this sort of stuff. So if I've missed anything, I'm going to lean on you to fill in.
No, I think you did a great job. I mean, I sort of, even thought about, like, what going through the whole thing, different milestones that we want to meet and things like that. But at the end, definitely, a formal presentation. We have, several groups and important stakeholders in this that probably would want to just some sort of information about it. And then I think, what you said about the interactive data, I think that's really important, so that we can not just do this one time, but just kind of, be able to use it for a long time to come too. So obviously we don't do these all the time. So
that's helpful. Thank you. Understanding for the final deliver plus kind of the communication value we needed to have both at the different levels. Thank you.
Right. And we're really, we want to be able to have it be very user friendly.
Yeah. Yeah.
So the community can understand it, our partners, all of our, larger system kind of leadership, that it's really, you can get your head around it and apply it. And we want folks to use it. Like, we're not going to be, this ownership around the product itself, right? I mean, we want this to be available for anyone in our region that would benefit from having it to use to feel that they can do so. That's critical. And we struggled a little bit with how do we say that in the language in the RFP, but we really feel that way. So just so you know, the energy coming into this is intended to be to benefit all of our partners that are doing this work.
Thank you. We have another
Sure.
question, but I see John has his hand up, so maybe if there's time later, he can circle back.
Sure. Yeah, John?
Thanks. Yeah, so I've got two. One of them is really logistics piece. You went through pretty quickly, but all of the partners involved, because I think you talked about the K through 12, in that cradle to career, certainly the health departments, and most likely the WIB for that longer lifespan, and then behavioral health that may be through the county health departments. So if you could just real quickly go through a list of those partners and how, in working through this, how we would coordinate that. And then also, if you were looking at primary focus from like an age perspective, what that is. And then the third piece, Jess mentioned this, but as far as IRB approval, would this be through our own entity, through the Maryland Department of Health, or through both? You may not know the answer to that one.
I don't have the answer to the IRB. I'm writing that down as a follow-up. And can you just restate the beginning part of your question? I got.
Yeah, so you went through pretty quickly, but I want to make sure I'm aware of all of the entities that you all are coordinating. So when you talk about Blueprint, certainly that's the 5 county school systems, the health departments, most likely the WIB, but are there other entities? I'm just trying to think, piecing these together.
Sure.
Across the spectrum.
So our key partners in this process have been the local management boards in each of the 5 counties. And just so you know, they reviewed the local management boards and our school mental, and our school mental health coordinators had the opportunity to review this RFP to provide feedback. So we tried to make sure we represented their voices, but we've got the 5 local management boards, the 5 school systems, each of the counties, public school systems primarily. And of course, our health departments are very close partners. As Trish mentioned in our Midshore Planning Collaborative, we do all of our work across the board with our health departments specific to the behavioral health piece. And another entity that I know is very invested in seeing where this goes is our hospital system. So we have a lot of partners that will be eager to help convene to be a resource to you all. But those 3 big projects that are going on in the state right now is the Blueprint, which we don't have a lot of control over that, but we're trying to help be very informative to the process, right? And then our local management boards have really been tasked with that Enough Act initiative and executing what that's going to look like in our communities here. And a couple communities are really, in the more involved phase or activities associated with that, just based on their county population and eligibility. And then, of course, we've got Midshore Behavioral Health that is serving to support that consortium on coordinated community supports through the hub activities. So, and there's a lot of space where those initiatives and partnerships are overlapping. So this will serve, the final product will help serve and inform all of those process, we hope. And the lifespan piece is something that we organizationally at Midshore have just been eager to do since that 2014 installment of the needs assessment. We really want to look at, to the extent that we can, the whole lifespan. So it's a lot. And I think, you know, of course, it's stated in the RFP that the hope is to have this finalized, wrapped up nicely by June 30. We need to, you know, be very mindful with working with you all in the event that there's something that seems to need to push beyond that for the success of the product. I think we're open to working with you all around that. It may just be that we have to get some support from the consortium around how we're modifying the timeline if that is needed, because we don't want to inhibit a good process or product. And we're very mindful it's a lot of responsibility wrapped into this project, and we just want it to be done well. So I'm just offering that. I'm not going to say we'll give you X amount of time, or we'll go on the record as saying that right in this space, because it would really be something we'd have to work with you along the way to determine setting up the vendor for success.
And I know, Katie, you mentioned, you know, all the stakeholders and things like that, but I think we also want a really good perspective on what's happening with the families and, you know, the community as well. You know, because we know that these kids are in school and they have families at home and grandparents and parents that are raising them, and there's generational things sometimes that contribute. So we want a really good representation of community in this as well.
And I'm just going to another clarifying question there. So the primary focus, because when I look, the main focus, you've got economic stability, career, behavioral health, is and just coming in, my thought was, is it primarily focused on those behavioral health needs and how they then impact those other components, or vice versa? But primarily behavioral health is the focus of the needs assessment.
I think primarily, yes, but what goes into all that impacts really just wellness and health in general is what we're seeking. And that, you know, we're very aware of, you know, how poverty impacts all of that, access to services, transportation. As Trish mentioned, the family is key. And we're hearing that across the board, even as we're gearing up to release the RFP for the next installment of our spokes for the Hub initiative. We are responsible for that in this new phase, and looking at how the community will be served in this next round of that, in those tier one kind of spaces. You know, how are we meeting the needs of what's going on in the household, not just what's going on with the counselor at school, but well outside of that, how does that translate? So I don't know if that fully answers your question, but definitely behavioral health, but that is like such a broad, how that's interpreted is pretty open. Okay, so I have Due East, then Tessa, and then Stacy. And just as a time check, we have 10 minutes left in this space. I did note the IRB question. That is something we'll look into to get back to you all and publish that. So Due East.
Oh, thanks, Katie. Building on John's question, actually kind of just going a little bit deeper, we know that the LMBs have certain results that they are, you know, responsible for. And a lot of those, to your point, get to social drivers of health. I'm just clarifying, you know, you want that broader frame. So you want to make sure there's alignment with the results the LMBs need to be responsible for, and that, you know, the results that are in the Enough Act, the results that are related to the consortium. So all of those, that was kind of earlier when we were talking about crosswalking, just making sure you want all of that in here. You want to make sure that it answers the broader picture of what's happening with across the lifespan as things that are could impact behavioral health, not just purely
Right.
through.
Right. To the best that they can be addressed.
I
Because
hear you.
we're aware it's a lot.
It is a lot.
And I
But
think just the strategy on how to even use this as a great foundation to build on. I think Trish mentioned that earlier. This might not be the end all of all the things, but if we have a good place to start, to really try to touch on as much as we can, that's what we're hoping for.
that makes good sense. And then just a procedural question. It doesn't say specifically asset mapping in here, but we know that part of the requirements of those initiatives involves asset mapping. I'm assuming that's separate, that's not part of this scope. This is purely on the needs side of the house, not looking at the asset side, right? Okay, just checking on that because I know that's another requirement. Make sure I didn't miss it in the RFP. Thank you.
Sure. Tessa?
Yeah, my question would just be, how open are you guys to a non-local firm? I know, well, like, again, we're based in Dallas. We're a team of 12, and we've done and do work nationally, but just curious, I didn't see that specific. I mean, I saw a line in the RFP regarding that, and as far as like having context. And so obviously, like, that's one thing that we would not have walking in transparently. And we do and would outline some things that we do in order to do some of that context building and are open to travel. But I didn't know if that is actually being evaluated in terms of you guys' rubric. I saw the chunks of like 20 points here and 40 points here, but not necessarily how much that would weigh into the proposal itself.
I think it's a great question. I think we would like to see, as you pointed out, how you would try to garner and make those connections in the community, despite, the ability to be readily available here all the time in person. So hopefully you'd be able to highlight ways that the deliverables would be achieved, given your remote arrangement. But it wouldn't, I think, you wouldn't be excluded from consideration. We just really want to see how you intend to still have success in soliciting that level of contact in the community.
And it was really neat to see a few community members on here just asking how they can help and how they can be involved stakeholders in the process. And so just as a follow-up to that, my question would be, do you guys plan to be the ones kind of making those community connections with the firm that's selected to say, hey, here's some groups that we want you to talk to or consider? Or is that something that you would hope that the firm would already have? Again,
I think we definitely want to be at the table to help make sure we're setting you up for success with who to include, who to contact. And that would be an ongoing dialogue, sort of you coming to the table, like, this is who we envision we need to really connect with. And we do this all the time. This is our work. So you're in good hands. We're invested in wanting to make this as successful as possible. So there's a level of commitment and involvement that our organization will have in our stakeholder and leadership group that we're working with. I think we're all just eager to get to work.
Yeah, absolutely. Thank you.
Sure. And Stacy?
Hi, would you recommend faith-based groups to submit? Okay.
Well, if a faith-based organization is interested in submitting, we would support their application being considered, but they're going to also be another key stakeholder to inform the process.
Okay. Thank you.
And Tessa, another question?
Yeah, sorry, one more if we have time. Do you guys have any budget set aside for compensation for those stakeholders that are being engaged in it? That's something that our firm is pretty big about, is just making sure that, I didn't know if that needs to come out of the $75,000 budget in the in our resourcing portion of the proposal, or if that's something that you all are open to having a separate budget for is anything from childcare to food to incentives, gift cards, or things to compensate folks for their time. Yeah, so just wanted to know if that's included or separate than the 75,000.
I'd like to take that back internally and talk about that a little bit more before I answer the question.
Okay.
Is that okay?
No, that's great. Thank you.
Just kind of see what our options are and if it needs to be included in the 75, or if we feel like there may be a little bit of a resource we could tap into to support that. I want to just talk about it internally a little more, if that's okay. But great question. Thank you for that.
Yeah.
Bess?
Yeah, great question. Thanks, Tessa. Best practice for sure. Thanks for considering that, Katie. And just you mentioned flexibility on timeline. Is there flexibility on budget, or travel expenses included? Just want to get a sense of how hard a number the 75 is.
I think we need to take that one back too.
Fair. Thank you. Thanks for addressing all these questions.
Sure. Anybody else? We have 3 minutes. Anyone else from the team have anything they want to offer before we close?
No. Just want to thank everyone for being here.
Oh,
It's been
This is
great.
great discussion.
Yeah.
And I have the questions around compensation and stipends, food, and the IRB.
Yeah, so that was, my question was, will that be posted on your website or will you email those out to us?
We'll do both.
All right, thanks.
Sure. And give us a
If-
couple days, but we'll get there.
I was gonna say, if you guys want to put your email addresses in the chat, I can make note of them to make sure that you get that, because I don't think I have everyone's that's on
Yeah.
the call.
Thanks, Taylor.
Mm-hmm.
Well, thanks, everybody. Appreciate you being a part of the discussion this afternoon and your interests. And if we don't see you, have a safe and healthy holiday and New Year. But also eager to keep up the discussion. So thank you so much.
Thank you.
Thanks, everyone.
Thank
Happy
you.
holidays.
Thank you. Bye-bye.